My name is Arjun Balar. I'm a medical oncologist and director of GU Medical Oncology at the NYU Pearlmutter Cancer Center, and I'm also an associate professor of medicine in the NYU School of Medicine. I presented data from Keynote 57, which is a phase 2 study of pembrolizumab in BCG unresponsive high-risk non-muscle invasive bladder cancer. The data I presented was an update to the interim analysis of the first 102 patients who were enrolled to cohort A, which is specifically patients with carcinoma in situ with or without papillary disease. What we observed in the 102 patients that were treated on this study thus far, at a median follow-up of roughly 16 to 17 months, is that the complete response rate in the bladder was 40%. Additionally, of the patients who achieved a complete response, the median follow-up was about 17 months, and in these patients, 53% of the responses appear to be lasting for 9 months or longer, which is encouraging. And in fact, at the current Kaplan-Meier estimate for median duration of response is about 12.5 months, suggesting that the responses in the bladder to pembrolizumab in patients with high-risk NMIBC can be potentially durable. Obviously, additional follow-up will be necessary. Also, of the patients who did not respond or then had responses and ultimately progressed, none of these patients progressed to muscle invasive or metastatic disease, which is a very important consideration in this patient population. Also, with regard to safety, overall the safety profile with pembrolizumab was consistent with prior studies involving this agent in other disease settings. About 2/3 of patients had some form of an adverse event. However, only about 12% of patients developed a grade 3 or 4 adverse event, and the rates of immune-related toxicities overall were quite low. Only 8 patients discontinued treatment due to an adverse event, and there were no treatment-related deaths on this particular study. So overall, in summary, the activity in terms of complete response rate of 40% at 3 months is actually quite encouraging. There's about a 12.7 months median duration of response, which will need extended follow-up, but overall the activity in this preliminary analysis is encouraging. There is a randomized phase 3 trial, Keynote 676, which is testing pembrolizumab in patients with high-risk NMIBC that have progressed after initial induction BCG, and patients are being randomized to either reinduction BCG alone or reinduction BCG with pembrolizumab, which will add to the knowledge about pembrolizumab in this disease population.